Hey everybody, welcome to the Cop House Podcast. I'm Doug and I'm the son.
And I'm Ron. I'm the dad.
This is a bi-weekly podcast that covers all things policing. We're a father and son duo with over 33 combined years of police experience. Our show will tackle anything and everything you could possibly think of regarding the great policing profession. Nothing's off limits.
Welcome to episode 10, if I'm not mistaken, of the Cop House Podcast. We are two generations, one great calling. And Doug, I think we could probably say 34 combined years of police experience, although mine has frozen in time. Yours continues to grow.
Yeah. Ish. Who's counting?
Yeah, who's counting?
We're back. We took the summer off.
We did, and a portion of the spring.
Well, we don't get paid for this.
Oh, true.
But people apparently like it. They want us to come back.
Well, good. Yes.
So here we are. We're back.
Do you know what today is?
Besides your birthday?
It is my birthday. Do you know what else today is?
I bet you're going to tell me.
With respect to policing. Today is the 2-year anniversary since I retired from the great policing profession.
Mm-hmm.
Do you know why that's significant?
Because your MCOL's expired.
Yes. My in the state of Michigan, my police license went from a state of whatever to dormant, which means if I ever wanted to jump back into policing, I'd have to go to like a little mini police academy.
Like a refresher academy or something.
So probably not going to happen, but maybe, who knows?
Unless you apply today and get hired today and start today.
As soon as I leave here, I'm going to go start policing again or not. Hey,
or not.
What are we talking about today?
Today we are talking about pandemics and especially how it relates to police work, which sounds boring, but don't leave.
Yeah, don't go anywhere. Because
it's not.
We're going to tackle this. We're going to try to tackle this from two different perspectives because Doug and I were both police officers during the pandemic in February, March, and April of 2020.
Which pandemic? Scarlet fever?
The great influenza from 1918. I'm not quite that old.
Oh, okay.
Yes.
All right.
And we're going to try to tackle this from the perspective of a road officer, a patrol officer, and from the perspective of police administration, police and fire administration, because that's what we were doing in February, March, April of 2020. Doug, you were with Detroit, right?
Mm-hmm. Yep.
As a road officer.
Actually, when it started, I was in the PDU. I was in the detective unit.
Okay, right.
Like when it first started.
Right.
I'm so glad that stuff's over. COVID.
Yes.
That was stupid. That was a stupid time to have to live through.
Right.
It was ridiculous.
Well, you bring up a good point. We're going to talk about policing in a pandemic, and I'm not going to try to make any judgment calls on.
I, however, have some stronger opinions that I will mostly try to keep out of this.
I'm not going to make any judgment calls on the merits or the dismerits. Dismerits? That's not a word. I'm not going to make any judgment calls on the merits of the pandemic or COVID-19. Simply, how did it affect us in policing? How did it affect my agencies and you as well? I also will try to keep some judgments out of it in terms of overall, but I'm definitely going to lay some judgments about how some departments handled it. Okay. Is that fair? That's fair. Sure. Right? Sure. Yeah, let's alienate all the departments we don't like. I'm kidding. We're not going to alienate anybody. So, mostly. COVID-19. We had not had a worldwide pandemic, to my knowledge, since 1918. At the end of World War I, when the Spanish influenza, which, I think was unfairly labeled the Spanish flu, conquered the world, not conquered the world, but there was a huge death rate at the conclusion of World War I. We had not, our globe had not experienced a pandemic since then. And so here we are in March of 2020, when the World Health Organization declared a global pandemic. And it basically turned policing, the fire service, emergency medical services, hospitals. It basically turned the world on its ear. But because we're the Cop House podcast, we're going to discuss how it affected policing primarily. So I guess just to give a little history, in right around January of 2020, I'm a bit of a news junkie. I don't like to use that word, but I enjoy looking at national news, global news. And in January 2020, I was really kind of following this unknown virus as it was spreading throughout various nations around the world. And Doug, I remember in mid-January or so, I remember going on Amazon just out of curiosity to look at how much a face mask cost, like a surgical face mask, to see how much it costs. And I don't remember exactly what it cost, but it seemed to be a normal price. Well, then about a week or so later, I went back onto Amazon and I looked, and it had jumped threefold. It was like 300 times more expensive than it was the previous time I looked. And at the time, I was not only the chief of police, but the director of public safety. So I oversaw police and fire, and I thought, oh no, what is this going to do to our budgets? What's this going to do to supply? And it was right around early February that I asked my staff to start purchasing some of this stuff because I figured we were probably going to need it. Do you recall what you were doing in, February of 2020? You said you were in the detective unit.
Yeah,
right?
so I remember the first time like really starting to kind of know that something was going on. I remember we were in the PDU, Precinct Detective Unit office at the 8th Precinct, and there was a few of us who were just kind of standing around somebody's computer. They had some news report pulled up, some virus. They were talking about they didn't really know a whole lot about it. They thought it might have some kind of measurable mortality rate, but nobody was really sure. They weren't sure where it was. There were people saying that it'll never be in the U.S. There were people saying that it was already in the U.S. And I just remember it was like the beginning of like a zombie movie or like a zombie show. I don't know if you've ever seen like World War Z or a movie like that, but when everybody's just kind of, it's all rumors, people are watching the news, people are starting to worry. It was just a lot of people not knowing what's going on and like, is this something that's going to affect us in the future? And I remember me thinking, no, it's not. Things are going to be business as usual. This is nothing. This is just people freaking out over nothing. And little did I know, a few weeks later, our entire office would be being paid to be home because one person in the building got it.
Right.
So at this point, it was just chatter amongst the guys around the detective unit. You guys just talking. The department, Detroit Police Department, the bosses had not done anything official at this point yet. Nope.
Okay.
Nope. We're just, I remember standing around, I don't remember whose computer, but we were standing around somebody's computer and they had some news story pulled up. They were talking about it.
Right.
But
well, I remember in mid to late February, again, keeping a close eye on it. We had already started to purchase some supplies, extra gloves, extra masks. And even then, in mid-February, late February, things were starting to get tight. I mean, we were being told, we can get it to you, but there's going to be a delay. It'll be on back order, whatever. And then I remember the very first case of COVID-19 that was reported to the media, Seattle, Washington, if I'm not mistaken. It started on the West Coast. That was the first one.
Yeah, I don't remember.
Yeah, first one I remember. And I remember at that point calling the police command officers and the fire command officers together and saying, okay, it's here. We don't know what it is. We don't, like you said, we don't know what the mortality rate's going to be. We don't know what this is going to do to our budgets, our run volumes. How sick are we going to get? And we, before the pandemic had even been, before a pandemic had even been declared, we were already starting to make plans in the community where I worked. The city manager where I worked was the emergency manager, and I was the deputy emergency manager. That's typically how it goes in municipal government. It's either the mayor or the city manager who's the emergency manager for the community. I was his deputy emergency manager. So we started also making plans for how is this going to affect the city, and boy, did it ever affect the city. At any point, Doug, did you work from home? I don't recall, because you were in the detective unit, right?
Yeah, no, I didn't work from home. I remember when it first kind of started to be something like, okay, this is something that's like in the area. You know, you can't close a police department.
Right.
I mean, tons of businesses and stuff were closed, obviously, but I remember it was mostly like procedural changes. So like one of the first things that happened was they got paranoid about as soon as it was confirmed to be, you know, in Michigan and Southeast Michigan, whatever. The department, I would say, was pretty paranoid about it. And if you were even near somebody who later was found to have it,
right,
you got sent home for a certain amount of time. And I mean, they paid you, stay home. Right. And it was actually kind of under threat of like, if we find out that you're out doing stuff while you're home, being paid to be home, there's going to be disciplinary action for it.
Right.
So like I said, one of the first things that it actually started to affect me at my job was there was one guy, a detective, who was in our office. And I remember at the time almost thinking it was kind of silly because I sat on the opposite side of the room as him. We didn't even work the same hours.
Right. But
he got it. Everyone in our whole office was sent home, paid for like, I think it was like 2 or 3 weeks. Yeah, that was the first thing for me that I actually remember when it actually started to affect things. I got bored sitting at home.
Right.
I mostly just played Xbox with my little brothers.
Right. For us, and where I worked for the city of Wixom, which is a small jurisdiction in Southeast Michigan. For us, I remember the very first officer. Again, we had no idea what we were dealing with. There was no one around from the 1918 Spanish flu. It wasn't like we could call up an old retired police chief and say, hey, how did you handle the Spanish flu? I mean, it was almost over 100 years ago that happened. There was no one to call. There was no playbook. There was no standard policy to follow. I mean, we were writing this stuff as we went. And I remember, you might laugh at this, and our audience might laugh at this, but I remember our public works. You couldn't get your hands on thermometers. You could not get your hands on thermometers when this broke. I remember our public works department. Now, in a city, you've got a public works department. They're the guys who plow the snow and make sure the grass is cut and maintain the buildings and all that. They came by to the various departments around City Hall, particularly police and fire, and they brought these thermometers that you use like to take temperature of asphalt. Like they were laser pointed thermometers, but they're used to measure the temperature for like road asphalt to see if it's hot enough to pour or if it's cooling, whatever. And in the early stages of the pandemic, before we could get our hands on, medical grade thermometers, that's what we were using to take the temperatures of people. I mean, it was crazy. Nobody knew how to handle this.
Yeah.
And I remember one of my officers coming in, a good friend of mine. I took this crazy little thermometer and just in jest, joking, I pointed it at him and says, "Hey, I got you." And he registered having a fever. And I'm like, oh no, what have I done?
Yeah.
So out comes the fire department, and they're covered in head to toe in Tyvek suits and all this. And they're taking it was crazy.
Yeah.
Nobody knew how to deal with this.
I actually, the first thing I actually remember, I said that the first thing that actually affected my job was when the one guy got it and we all got sent home. But the first thing I remember actually even being a thing even remotely related to it was being in the detective unit, sitting at my desk, and it started off as a joke. Like if somebody sneezed, somebody would stand up in the office and point at you and go, COVID.
Yeah. Yeah.
It was a joke at first.
Right.
Or somebody coughed or something. I had a cold around the same time, and I kept getting accused of having COVID, and it was mostly a joke. But there was people who like wouldn't come over to my desk.
Right.
I'm like, guys, I have a cold.
Yeah.
Stop.
And, I think the recurring theme throughout this episode is going to be we had no idea what we were dealing with, and especially in those early stages. This poor guy, dear friend of mine, one of my officers, but also a dear friend of mine. I mean, he had sheer panic on his face. When this stupid little asphalt thermometer registered a fever on him because I was being an idiot and joking around with it. And then here comes the fire department, and they look like Darth Vader, and they're taking a thermometer, and he actually did have a fever.
Yeah, but I mean, it's almost like people forgot that like could also just have a normal stomach flu.
That's right. But in those early moments, he did. He had a wife and a little boy at home, and we're like, what do we do with him? We didn't even know what to tell him.
Yeah.
Other than go home and go up to your bedroom and close the door and have your wife leave food outside the door for you till we can get you in for a test. And trying to get someone in for a test, forget about it. I mean, there was a waiting list.
Well, they hadn't really developed tests.
That's
at
right.
first.
Right.
Yeah.
Right.
So I mean, kind of, unless you had something else on that, I mean, at that point, kind of fast forward to how it started to affect the job.
Yeah. I can tell you in the city of Wixom, because I was the public safety director, and we took a hard look at police operations and fire operations, and decided that police officers were not responding to non-emergency runs anymore. Or at least for the duration till we figured out what was going on. So if you got into a crash and nobody was hurt, we weren't coming. If your car got broken into and it was not an ongoing crime in progress,
there's not somebody actively breaking into your car right now,
we ain't coming. We ain't coming. You can call it in. We'll give you a report number over the phone and take your report over the phone, but we're not coming. Kind of same thing with the fire department, and the fire department medical calls for service went through the roof. Every time somebody had a sniffle, 911, I think I have COVID-19. Well, these firefighters, man, they're, in the community where I worked, they weren't fighting structure fires every day. Let's be honest. They were taking medical calls, medical emergency calls, and I use the word emergency loosely. They were running on medicals all day, every day.
Yeah.
So,
I remember too, something that started was, my department mandated wearing masks in the building, on calls, in the car, which even at the time.
Yeah. Talk about that from the perspective of working as a uniformed road officer with a mask on all the time.
Because shortly after it started, I ended up leaving the precinct detective unit and going back to the road, working afternoons at number 8. So I was on the road for like, I'd say a large part of the whole thing.
When you weren't dealing with protesters, that's a whole nother. that could be its own separate podcast.
Yeah, I think we're gonna have a guest and talk about the summer of 2020 in Detroit. I got a buddy who I think might be interested in coming on for that.
And just a teaser for the audience. I'm sorry to take us down this rabbit hole, but just a teaser for the audience. That would be an episode you folks would want to tune in for, because Doug spent the summer of 2020 on a mobile field force unit dealing with protesters and rioters in the city of Detroit every day. Folks,
it was the whole summer.
Yeah, folks, I remember watching Doug on the 10 o'clock news. Not every night, but many nights I'd look and I would try to pick him out of the crowd, and usually I could.
Pick me out on the riot line.
That's right. Yeah. So go ahead. I'm sorry.
No, you're good. That would have been more towards the summer, obviously.
Right.
Which, like I said, I got a buddy who I got to talk to him and see if he'd be interested in coming on for that, because he was there with me for the whole time, and he was a little more involved with a lot of the planning stuff than I was. It was wild, but like you said, that's for another episode.
Right.
Masks,
Yes.
working patrol. I remember thinking at the time that it was a bit ridiculous, and this is going to be kind of where some of my opinions about it maybe come out, because I think it's fairly undisputed at this point that most of the masks that people wore were useless. I don't even you can correct me if I'm wrong. I haven't heard anything about COVID in a long time, but I think it's retroactively been fairly well decided by whoever makes those decisions. I don't know. I don't really care. But from everything I've heard, it's been retroactively said that, yeah, those never really did anything for the most part, unless you have like a full, whatever they call it. They're rated for whatever.
Yeah, the N95, is that what you're talking about? Yeah.
Yeah.
Right. And those were so cost prohibitive. You know, communities were not running out, to my knowledge, and buying N95 masks by the pallet full because it was so cost prohibitive.
Yeah, but the bandanas, the surgical masks,
the gaiters,
the neck gaiters, never did anything for anybody ever.
So what was it like responding to calls for service in Detroit? Many of them probably calls in progress, violent crimes, calls where you probably had to lay hands on people with, wearing a mask or
ridiculous. I mean, that is, if I had to put it in one word, it was ridiculous. It was, I remember watching body camera video. I was working with a buddy of mine. We ended up having a call. It was somebody having some type of, he had some underlying psychiatric problems, I think, but huge guy. Dude's like 6'4", 280, big dude. And we ended up in a knockdown, drag-out fight with him because he had tried to come after family members of his with a knife. And we ended up finding him walking down the street and ended up in a knockdown, drag-out fight. I remember watching the dash cam video from my sergeant was there, and he had his car positioned, so his dash cam caught the whole thing. I remember watching it and seeing me and my buddy fight with this guy, roll around with him on the ground, and we have these stupid masks on. And at one point, the guy grabs my vest and he tries getting on top of me, and I can't hardly see because I have this stupid mask riding up in my eyes.
Right.
I would say it was more of a hazard than anything else.
Gotcha.
It was a barrier for effective communication. It made it harder to talk to people because anybody with any type of psychology or body language education will tell you that so much of your communication doesn't come from what you say. It's facial expressions. It's mouth posture. It's stuff that you do non-verbally. So it was a barrier to effective communication. That and the fact that it's objectively harder to hear somebody who's wearing a neck gaiter over their face, or even a surgical mask. I think it's almost a joke in movies sometimes. There's some nameless, faceless doctor in the room, and you can't hear what he's saying because he's got the surgical stuff on. That's how it was.
Right.
You can't relate with people because they can't see your face. It made communicating with people, especially in any type of high stress situation, immeasurably harder, and immeasurably less effective. It was, and you almost can't blame anybody because, as you've said before, nobody knew what we were dealing with. Nobody knew what was going on, but it was a net negative, and I will die on that hill.
Well, it's interesting when the pandemic came out. I had been a policeman for 25 years, and I've said to many people, including your mom, if you had told me 25 years ago that I could walk into a bank or a convenience store with a mask on, and it would be not only socially acceptable but demanded, required. I would have said you were nuts. What do you mean I can walk into a bank with a neck gaiter all the way up to my eyeballs and a ball cap pulled down to my eyebrows and walk into a bank like that? No way. Well, it was required. So yeah, interesting. From my perspective on that, I recall, and this is burned into my memory, I remember early on in the pandemic, again, we weren't, there was no information yet on how to quarantine, how contagious you might be. We didn't know anything. And I remember my phone rang one night about 2-3 o'clock in the morning. I was the police chief, and I got a call from one of the officers working night shift, and what I heard on the other end of the line, I couldn't believe what I was hearing. There was 4 officers working, which is kind of unusual for Wixom, but there were four guys working, and they had gone on a medical emergency run where CPR was in progress, and all 4 of them went into this apartment, into this enclosed space, and 2 of them were doing CPR on this guy before the fire department got there, and the guy he died from COVID-19 right there on the floor of the apartment. I've got an entire night shift now that's been exposed to COVID-19, and they're wanting to know, what do we do? And I said, I have no idea what you're supposed to do. I said, for now, don't go into the station, I guess. I don't know what to tell you. Doug, I remember pulling up into the back lot. I went in, as did my lieutenant. I remember us getting into the police station, and it was a cold March night. It's 3:00 in the morning. It is very cold out. And I remember looking kind of across the courtyard near the back door of the police station, and there's one of my officers standing there. Just with this bewildered look on his face, almost like terror, fear. He can't go into the police station because he's been contaminated. He's not sure if he should go home because he's got a wife and 2 kids at home. He doesn't know what to do. And from a management perspective, from an administrator's perspective, I didn't have many answers for him.
What was the outcome, at least, for that night?
For that night, we had him stripped down. I mean, not completely to where he was wearing nothing, but we had him stripped down out of his uniform, outside, bagged up his clothes. We had an agreement with the local dry cleaners to do their best to try to decon. The dry cleaners didn't know how to handle it. To decon the clothes. We now have 4 police cars that are potentially out of service. Well, we only had a fleet of 6 to begin with. And now we got 4 of them that need a biohazard decon. So we had an arrangement with a local hazmat crew that does like crime scene cleanups. Fortunately, they were right in the city where we were in Wixom. So I knew the guy, had his phone number, which is a good case for building relationships before there's an emergency. Called the guy and says, hey man, 2/3 of my fleet is out of commission. Can you come out like tomorrow, like immediately as soon as the sun's up, and get some of my police cars back in service? And we sent all 4 guys home, had to call in the other night shift. I mean, it was an absolute mess. And we were all feeling around in the dark, trying to figure out how to navigate this. It was crazy. And I haven't even addressed yet what we did with our City Hall employees. So far, we've just covered this from the perspective of police, fire, but I'm also the Deputy Emergency Management Director. So we have City Hall employees to deal with too, but I'll get there eventually. What were you going to say?
Just how wild the whole thing was.
Right.
And how, I don't know, at risk of sounding like I'm trying to provide some type of broader commentary outside of my scope, I think the whole thing from the top down was just so, when I say top down, I'm talking about federal government. I'm talking about media, like national media. It was so mishandled, and they just did. It seems like everything they could to make it more confusing and make people more fearful. I don't know.
I felt bad for the police officers and the firefighters. The actual guys and girls working, directly delivering police and fire services. And the reason I felt bad for them was they were scared. Every time the fire department rolled an ambulance out of their bay, they were top down in like Tyvek suits. So every call they went on, they were thinking they're one cough or one sneeze away from death. The officers, they know, like you just said, they know there's times they have to put their hands on people and wrestle with people. They're thinking they're one bad call away from death. And on top of all that, every time they came to a new shift, we were putting out a new policy because the county or the state or the feds were putting out a new protocol. So we would say to them on a Monday morning, okay, this is what we're doing. By Tuesday afternoon, you could throw that protocol right in the garbage because it's all changed for Wednesday morning.
Yeah.
I spent the pandemic at my computer typing protocols. That's how I spent the pandemic.
Yeah.
People say, hey, Ron, what changed for you during the pandemic? Nothing. I went to work every day. My kids were homeschooled anyways, so there was no change for them. Mm-hmm. And I went to work every day. The biggest difference was I spent it at a computer typing up a new protocol every 24 hours.
Yeah. I remember, speaking of protocols and just kind of going through some of the things I remember Detroit PD doing at the time. Obviously, masks were one of the first things required on patrol, in the cars, in the building. I think at first, unless I'm remembering incorrectly, I think at first it was just you have to wear one when you're in the building, and then it changed to in the building and just in the car with your partner, and then I think it changed to anytime you're dealing with the public as well, and then I think they just changed it to all the time. The entire time you're on the clock, you are wearing a mask. Out of the car, you could be standing in the middle of a field by yourself, and you'd have to have one on.
Right.
Which I think even with the information then was ridiculous, but that's neither here nor there. I remember a particular person in a position of supervision at one point sitting and watching cameras for the precinct and writing up people who walked in the building to go change for roll call without a mask on for the 4-second walk from the back door to the locker room, because most people didn't want to be caught without their mask, so they kept it in their locker, so they would always have one at work. So then they walk in the building without one and catch it right up, before even being on the clock. I mean, just, I don't know. Yeah. I don't know. I keep saying that a lot of this I think was an overreaction, and I think it was, but to be fair as well, like we've said several times already in the past few minutes, there wasn't a lot of information.
No.
So, at least not at the beginning.
Yeah. And, I'm such a nerd. I remember right around mid-January, as I'm watching this spread from nation to nation, I started reading books on the Spanish flu because there was no information. I couldn't go to the International Association of Chiefs of Police and pull up a white paper on pandemic response. I couldn't go to the Michigan Association of Chiefs of Police and pull up a research document on pandemics. I started reading about the Spanish flu, and it was
the last one.
I'm starting to think, back then in the 1918 Spanish flu, the local police, part of their job was to go door to door and collect bodies, to collect the deceased. That was part of the police duties, and I'm thinking, what are we facing here? You know? And I that's just me. I started reading all I could, and because again, we had no idea what we were dealing with.
And what kind of a sad part of it is?
What's that?
I think if this happened again, exact same thing with a different disease or contagion or whatever, I don't think it'd be any better.
No.
I really don't.
I think the learning curve would be shorter. I do. I really do, because
I might just have to disagree with you.
Well,
that's all.
I'm just thinking, as I sat down as I and the other chiefs that I know, as we sat down at computers, as we sat down and got together and started strategizing how we're going to deal with this, it was like we were creating this stuff out of thin air. I don't think you would have to do that.
I think from like a local PD perspective, I think you're right. Like lower, more local level administration and things of that nature. I think you're right.
Right.
But I'm saying just as a whole, on the federal level, national news level, federal government, state governments, I don't think it'd be any better. I think it'd be exactly the same.
Maybe.
If not worse.
Maybe. I just remember, me reaching out to chiefs I know from much larger agencies and say, hey, you got a protocol on this? Nope. So I'd write one. And then, a chiefs I know from smaller agencies than Wixom, and Wixom's small, but smaller agencies would reach out to me and say, hey, you got a protocol? I says, I do. It probably sucks, but you can have it. So I'd send it over to them and say, here it is for what it's worth. I just made this out of thin air. I mean, that's what we were doing. From an emergency management perspective. Now, when I say emergency management, that's kind of a loaded phrase. Emergency management has to do with, what do you do to manage the emergency? No, that I just broke one of my. Never mind. From an emergency,
thanks for that.
Yeah, thanks for that great definition there. From an emergency management perspective, that has to do with, okay, how are you going to, where are you going to find the money to purchase the N95 masks that are unavailable anywhere? Where are you going to get the money to buy the gloves that you hadn't budgeted for? Oh, by the way, that aren't available anywhere. How do you declare a local state of emergency? I mean, these were all things that we had to wade through and figure out how to do. And the other piece of this that I got intimately involved in is, what do we do with all of our City Hall employees who are, quote, non-essential? But, when you're talking about your finance department who puts out the paychecks, they're very essential, especially when people aren't getting paid. But,
I hated that phrase.
Oh, I know.
Essential employees.
I know.
That was so dumb.
I agree, Doug. I do, because,
ridiculous.
We were police officers. Up the road were the firefighters. Down the street were the EMTs, and they were essential. Well, I'm sorry. Yes, public safety is very important, but to start categorizing people, the guy who runs the convenience store, he's non-essential. I hate that.
Yeah, it was dumb.
It was a false dichotomy that.
And the other thing too, and anybody who's listening and gets mad at me for this, shut it off. I don't care. You can leave. The people who changed their Facebook profile picture to say, I can't stay home, I'm essential. You can shut it off. I don't care. I don't want you to listen anyways. That was stupid, and you were a jerk for that.
Anywho, so
that's my opinion. I don't represent any police department right now.
Okay. Right on.
I also don't represent you. If you disagree, whatever.
I wouldn't dare. Be nice to me. It's my birthday.
Do you remember that? Do you remember that? People changing their Facebook.
I
Ridiculous.
do. I know. So what did we do with our City Hall staff? Well, I mean, we had to make a decision, who stays and who goes home. Mm-hmm. And by the way, we don't have laptops for everyone. Where are we going to get the laptops from to send them home?
To work from home.
To work from home, yeah. We sent Wixom, being, a smaller agency, we had a 3-person detective bureau. We sent our detectives home to work. For the first time in my life, in my policing life, we had detectives at home, working from home, handling their calls, handling their follow-ups, as many of them as they could by telephone.
Yeah.
Crazy. And then I would say if our City Hall staffed 25 to 30 people, I would say at one point we were down to like 3 or 4. 3 or 4 who were working in City Hall. I remember the first morning after the city manager and he's the big boss, deciding to send them all home. I remember walking through City Hall like on a Tuesday morning, and it was dark. It was the creepiest, eeriest feeling ever, knowing that on a Tuesday morning, not only is City Hall closed, it's dark, and there's nobody up there working.
Yeah.
Strange feeling.
There was some other procedural stuff that's kind of, as we're talking about it, I'm remembering that we did, how Detroit changed. You were talking about how detectives would handle most stuff by phone,
right,
from home. So, like we said before, at the early stages, I was in the detective unit. We didn't work from home, but one thing we did do is phone interviews were far more permissible. At the when I first started there at the detective unit, it was kind of, I don't want to say it wasn't allowed, but it was frowned upon. It was if you could go out and get an in-person interview, go get the in-person interview.
Mm-hmm.
You know, it was lazy. They didn't prefer it. The prosecutor's office didn't like it when you got phone statements.
Right.
That changed. It was all phone statements.
Yep.
Everything you did was a phone statement. We stopped doing in-custody interviews, in-custody interrogations. So how it would usually work if somebody got arrested and the case was handed to a detective to put together the documents and everything that they need to actually file charges and stuff like that. One thing that detective or investigator would then do is go to the Detroit Detention Center and get the statement, interrogation, whatever you want to call it, of the person who's in custody. We stopped doing that. We started filing basically all of our charges, all of our in custody stuff without the statement of the person who was in custody. They didn't want any more people in a room together than ever had to be.
Right.
So rather than go take them out of the lockup area, bring them to an interview room or an interrogation room and talk to them, they didn't want us doing that. So we stopped doing it, which for some cases was a blessing because some of them, it was a waste of time to drive over there anyways.
Right.
You know, you're in custody CCW cases, which at the time was a lot of what I was handling.
Carry concealed weapon. Yep.
Yeah. You know, they would grab the person or investigate the person for something, find them to be in possession of a unlawfully concealed handgun and arrest them for it. I personally think it was kind of a waste of time to go get a statement from them on that anyways, because it was on their person. Most of them will just say,
it's not mine.
Yeah. Or they just wouldn't talk to me. And it was from my precinct. It was like 25 minutes each way to the detention center. So I'm like, okay. Yeah. So now I have to take an hour out of my day to go there and back to put in no statement provided on a possession case where it was on their person.
So you stopped doing that.
Yeah. So total sidetrack, but that was a lot of those some of those were pointless to begin with.
Sure.
But yeah, we stopped doing in custody interrogations and did a lot more phone interviews.
Was the jail reluctant to house prisoners? Yeah, I can tell you the Oakland County Jail where I worked, you know, or where in the county I worked, they weren't housing very many people unless they were very, very violent.
Yeah, we had I guess a directive. It wasn't a department policy, but it was like a temporary directive for, you know, a list of things you can arrest for and a list of things that they will no longer accept in custody arrests for.
Right.
Yeah, like you said, basically anything nonviolent, forget it. You weren't taken to the jail.
Right.
I think domestics were about the only thing we actually still brought people there for.
Right.
And even then, they wanted a pretty ironclad. You have statements, you have video, you have something. If it was like he said, she said stuff, or what I would say more minimal stuff. Not that any domestic is minimal, but a lower level assault, I suppose.
Sure.
They weren't thrilled about they still would, but they weren't thrilled about it.
Yep.
Yeah, it was pretty weird.
Yeah.
It was a weird time to do this job.
Sure was. You know, we had a standing this was early in the pandemic. I mean, we weren't doing a whole lot of Zoom. Nobody knew how to set up Zoom.
No.
But we had a standing conference call at 7:30 with all the department heads, you know, and so the city manager would get on, I'd get on, my secretary would get on. I had her working from home, my secretary, but she would get on this conference call, and the fire chief, and we'd all get on there and, you know, kind of do a round robin on what's going on. Of course, the fire chief and me, we sucked the air out of the room. We were doing most of the talking. You know, you'd get to the finance director. Okay, what's going on from your perspective? Nothing. I mean, you know, we're working from home. We're making sure people are getting paid. We're paying the city's bills, but that's about it. You know?
Yeah.
Yeah. Oh, it was an interesting time.
Got another one.
Yeah, go.
They wanted us when I was working the road during COVID, they wanted us to, at one point, the governor of Michigan had some order about being in public places and stuff to include parks,
right,
areas of outdoor public recreation, things like that was prohibited.
Right.
And they wanted us to roll through the parks and investigate and ticket anyone who was in a park at any time. Yeah. And that was another thing that was ridiculous. I remember most of my shift, I can only speak for the shift of people that I worked with, refused to. And we even told, we were on good terms with our supervisors, and this was in no way intended ever to be in insubordinate or disrespectful fashion, but we told our shift supervisor, we're not doing that.
Right.
That's unconstitutional. There's no law that says that you can't be in a public park while the park is open.
Right.
I'm not going to charge people with any type of civil infraction, misdemeanor, whatever it was. There was some obscure ticket code for violate a governor's order or something like that, and we told our supervisor on that shift, and he understood and he was on board. He was basically only telling us because he had to tell us. He was on board with it. We're like, Sarge, we're not writing this. He goes, okay,
yeah,
all right, cool,
yeah,
don't care.
I'm not going to go into the specifics, but I had requests, as the police chief, I had requests from state and county officials that I told them, no, we're not doing it. We're not enforcing that.
Yeah.
No.
Yeah.
I'm 2 years away from retirement. Ta-da. Whatever. We're not doing it.
Like I said, I can only speak for myself and people that I know well personally and knew well personally at the time, but we wouldn't do it.
Right.
I think that would have been a gross trampling of people's personal rights and freedoms.
Sure.
And I wasn't willing to do it. And most of the people I knew and was friends with weren't willing to do it.
Right.
And lo and behold, retroactively at other precincts, other shifts where people did write those tickets,
they got sued.
No.
Okay.
No, I don't think the officers got sued, but every one of those tickets was dismissed.
Oh, yeah.
Wow. It's almost like it was a garbage. Never mind.
Okay.
Never mind. I'm getting, like I said, I'm trying to be objective about what we went through and experienced and not inject too much of my personal feelings. I guess.
You're doing well.
For the most part.
We talked about this a little bit offline and said, the name of the episode is Policing in a Pandemic.
Trying to keep it relevant.
Not politics in a pandemic or policing.
I'm keeping it relevant.
You're behaving yourself.
I am behaving myself.
Proud of you.
I'm not even that fired up over here.
Anything else? I mean, there's probably other things if I thought hard enough I could remember, but it was the police station was a lonely, cold, dark place. City Hall was a lonely, cold, dark place. People just weren't there. I mean, I started to miss my friends, and just got sick of jerking people around with a brand new protocol every 24 hours. I'm just tired of it. It was an interesting way to end my career.
It was just weird. I don't know. That's my I guess to wrap it all up, it was very, very weird.
Yeah, and it affected, obviously our perspective here was, from an administrative perspective and from a frontline direct delivery of police services perspective, and I think we both agree it was an odd time to be in policing or public safety. So, yeah.
How'd I do at not getting fired up about political aspects of things?
You did well.
Thank you.
You did.
Trying to keep it relevant
we'll save that for another
to
podcast.
Our experience. I think we'd have to start a whole different podcast.
I think so. Yeah. Right.
And probably pretend like we don't know the guys from this podcast.
Right. All right.
We're back.
We're back. Oh yeah. Do you want to give a little sneak peek of what's coming?
Yeah, we're back. We haven't really talked about a schedule going forward. Got a lot of stuff going on outside the studio here, so I mean we're still doing it. We're still here. We did not give up the podcast. Evan.
Wow, you called him out by name.
Yeah, he'll be happy about it though.
Wow.
So we didn't quit. We're still here. We got a lot of stuff going on. We don't we don't have any sponsorships or anything yet, so we're not getting paid for it. So this is just for fun. It's for anybody who listens, who enjoys it. We'll do it when we can. We'll do it when we have good stuff to talk about.
But we do have a couple shows in the pipeline.
Yeah, we got 2 lined up, and it's basically you could call it the same episode and a 2-parter if you want to. That's probably what I would call it. I'd call it a 2-parter coming up.
You're not going to give them a thing about it, are you?
I was thinking about it. You want to? We can.
Yeah, give them a little something.
Okay. All right. I will. So we're doing a basically a 2-part episode on cold cases, and not just any cold cases. You are picking your favorite cold case, one that you think is interesting from history.
Mm-hmm.
I am picking one that I think is particularly interesting, and we're both going to basically become experts on our respective cases.
Right.
And for yours...
Yeah, mine is going to be...
Or are you going to tell them what it is?
No.
Oh, okay.
Well, I'm going to give a little... I'm going to kind of give the concept here.
Okay.
Mine is a very old cold case. It's at least 80 years old.
Pretty famous, too.
Pretty famous, 80-year-old cold case far away from here.
Mm-hmm.
On the West Coast. It's a West Coast, approximately 80-year-old cold case. Conversely, yours...
Mine is a little more modern. Not super modern. It's, it's a cold case, so it's old. Mine is from kind of this area, the area where I live, the area where you live, Southeast Michigan.
Yes.
It has a big angle. It has a big part of it that takes place in Southeast Michigan, and it's fairly recent.
And the idea here is we're going to become respective experts, I guess, if I can use that word, in our cold case, and then present it to the other one and let the other one ask questions.
Mm-hmm.
So as I do the research on the case I'm investigating, I'm gonna try my best. It's an 80-year-old case, so police protocols and procedures have changed a lot in 8 decades, but I'm going to attempt to look at it from a patrol perspective, from an investigative perspective, from any other agency involvement perspective, based on the sources I can get my hands on.
Mm-hmm.
And Doug, I'll expect you to kind of grill me and ask me questions about it, and likewise I'll do the same for you.
Yeah, and hopefully we'll have some good commentary, some good questions, and basically just pretty thoroughly go through them. It should be a good one to listen to.
Yeah, it'll be a 2-parter, right?
Yeah, because we were gonna do it within one episode where you go through yours and I go through mine.
Right.
As I started doing some of the research for mine, I'm like, that'd
be exhausting.
I can't do this in 25 minutes. It's gonna take a little more, which a lot of people do kind of like the long form podcasts.
Mm-hmm.
Some people don't, but I mean, you can listen to it in multiple sittings if you like.
Yeah.
It should be good. I think it'll be very interesting.
Yeah.
Mine's got a lot of heavy reading involved. We were going to try to record one of those today. No. We had to come up with something else. We weren't ready.
Right.
So I still have more reading to do. I will give a quick shout out, kind of relevant to my research for my upcoming one.
Yeah.
The Oakland County Sheriff's Office, which is the county where your police department was within.
Right.
The Oakland County Sheriff's Office, I don't know who they got running their FOIA stuff.
Freedom of information.
Yeah.
Yeah.
But I did FOIA requests for to get some documents relating to my case, and they are quick.
Fast. Yeah.
Yes. I did the FOIA request for the case file on a Saturday afternoon.
Yeah.
Monday evening, the whole scanned PDF was in my email.
Wow. All 6 million pages of it, right?
That part was about 120 pages.
Wow.
Yeah. It's heavy, old police reports, some handwritten, not easy to read. It's scanned about 400 times, so you can't read. It's hard to read.
Yeah, written in pencil probably back in the day. Cool.
Oh, man.
Yeah, so stay tuned for that. I think I'm going first with my case.
Yeah, because I think you're going to probably be ready before me.
Cool.
So,
all right.
It's heavy. It's heavy reading.
All right, man.
It'll be cool.
Good.
But
I just called you man. Sorry. All right, man.
Okay, Dad. Okay, guy.
Okay, guy.
Okay, pal.
Chum.
It's like that South Park. I'm not your guy, buddy. I'm not your buddy, guy.
Closing rituals.
It's been a while. I don't even.
Yeah, something about Facebook. And
yeah. Follow our social medias. The Cop House Podcast on Facebook, at Cop House Podcast on Twitter and Instagram. You can find us on any of the platforms where you listen to your podcasts. Spotify and Apple Podcasts are our big ones, but some of the more obscure ones we're on too. Are we even using our social medias anymore? You're in charge of social medias.
I am. I've dropped the ball. But yes.
Yeah, we haven't done anything in a while. You got to drum up a little interest before our big
Right.
2-part cold case
Right.
one that we're hyping up a whole lot right now.
And to our brothers and sisters out there delivering police services, thank you. Thank you for your service. As a guy who's been out of the mix for 2 years starting today, I am grateful for law enforcement. God bless you. Be careful.
Be safe, everybody.